How do you securely store your firearms?
I use a cable lock to keep my kids and family safe.
I keep my ammunition locked and stored away from my firearm.
I temporarily took my guns to the sheriff's office.
Help keep Central Oregon safe. Secure ammunition and firearms effectively, because creating time and distance might be enough to save a life.
Safety for your family.
Safety for others.
Safety for yourself.
Learn more at safefirearmstorage.com.
Deschutes County is an amazing place to live.
Ease of access.
Work and play.
Great place to raise a family.
I love the weather and the high desert.
At Deschutes County, we provide excellent service.
Beautiful.
We're here to help you.
Deschutes County is the heart of Oregon.
Everyone wants to be here.
Episode 34. This is the Inside Deschutes County podcast. We thank you so much for listening. I'm Eric Brion. Lots to talk about on this episode. So we're going to jump right in, give our topic today plenty of time, some room to breathe, because it's an important one to talk about. It's a sensitive topic, one that has touched a lot of people, suicide prevention and awareness. September is Suicide Awareness Prevention Month, and there's lots going on to bring that awareness to Central Oregon. So I've asked two members of Deschutes County's Public Health Prevention Team. I said that wrong. Deschutes County Public Health Prevention Team to join me today. Caroline Suter and Bethany Kuschel are here. Thank you both for joining us.
Thanks for having us.
Yeah, thanks for having us.
Why can't I say Deschutes County? Boy, I bobbled that one. But that's all right. We're just
episodes in.
Yeah, we're just going to keep going. 34. Can you believe that?
Yeah.
34 is kind of cool.
It's impressive.
Yeah, we've been going for a year and a half, so we haven't had you on yet.
No. Now we're here.
You're here.
Saving the best for 34th.
I know. 34, magic number. Well, first off, I normally don't do this. But why don't you both give a little introduction about what you do, a little about yourself, and maybe your background in this area, because it's an important one.
Mm-hmm. Okay. Well,
Caroline.
Yeah. I'm Caroline Suter. Yeah. My title is Mental Health Promotion Strategist, and I use she, her pronouns. So I work alongside Bethany in the suicide prevention program and mental health promotion. And kind of what drove me into this position, my background, even though I have a master's in public health, I have had several years in behavioral health. I'm from Eugene. I used to be an outpatient therapist working primarily with kids on probation and parole and their families. And, suicide has touched those individuals' lives as well as the adult lives that I used to work with. And I saw this posting that came up, and my family lives here now. Yeah. So a lot of things kind of converged at the same time. And I got to work in public health. So
yeah, nice.
Yeah.
Bethany.
Yeah. So my name is Bethany Kuschel, and my title is Suicide Prevention Program Coordinator. I came into this role about 3 years ago. My background is in human development and family sciences, and then my master's is in public policy. So kind of being interested both in working with humans, but also in that policy piece has really been great in this position. We might get into it a little bit, but Oregon is the first state with legislation around suicide prevention. So we get to use a lot of our public health and public policy backgrounds in the strategy part of this role.
Awesome. Yeah, I normally don't do that and have, usually we start with a whole bunch of chit chat and talking about how your summer's been and things like that. But I think when we're talking about something like this, I think it's important for people to know where you're coming from, what your experience is in that, and why you can speak to these things. So it's an important month.
Yeah,
September.
It is.
Yeah. Not just for the two of you who are doing outreach, but for a lot of people who've been touched by suicide. Can you talk about the effort that's happening in September here in Central Oregon? Because it's the Central Oregon Prevention Alliance, right? That kind of puts all of these events together. Maybe you can talk about some of the events that are coming soon
Yeah. Yes.
like within days here.
Yeah.
And how they can shine a light on suicide prevention.
Awesome. Yeah, thank you. So September is Suicide Prevention Awareness Month. And we know that for every suicide death, around 135 people are impacted. So that obviously means that there is such a large impact in our community. Most people have been touched in some way. So one way that we honor this month is by doing outreach and events. We are part of the Central Oregon Suicide Prevention Alliance, and we have this amazing outreach team that are putting on events. So I think we kick off starting this Saturday with the American Foundation for Suicide Prevention's Out of Darkness Walk, and that will be taking place at Alpenglow Park. Sunday, September 8th, is National 988 Day. And of course, 988 is our suicide prevention and crisis lifeline. And so we're just celebrating that day as being an amazing resource for people who need that support. Then we go into Thursday, September 12th, which is our annual Candlelight Vigil. And that's a beautiful event hosted by our outreach group that consists of suicide loss survivors and suicide attempt survivors. And the intention of that day is to remember and honor those we have lost to suicide and also provide hope and healing to the community when we gather to support each other.
Beautiful event.
It's beautiful,
Yeah.
It takes place downtown Bend at the Ben Lapine Schools Ed Center, right on that front lawn, right at sunset. There's music, there's community. It's pretty great.
Talk about the walk, the logistics of the walk, so people who can attend. Is registration?
It is technically a fundraiser, so they do appreciate if you register. However, if you can't, you can still go, and you can register when you get there as well. So registration starts at 11. There's a lot of booths, a lot of resources around, a lot of gathering, and then there's generally a speaker. There's generally community organizations that are involved in suicide prevention efforts that speak, and then everyone goes on a beautiful walk together all through Alpenglow Park.
Alpenglow Park, 11:45, right?
Yes, thank you.
The start time.
Yes.
Mm-hmm.
All right. Out of Darkness Walk, and then the 988 Day, and then the Candlelight Vigil.
Yeah, those are the first
Those
three.
are the first three. Awesome. Lots going on.
Yeah, and I would also highlight that because it's put on by Central Oregon Suicide Prevention Alliance, or COSPA, that spans across Crook, Jefferson, and Deschutes. So, anyone.
Anyone can come from.
Yeah, if they would like to.
Yeah, everyone's invited. Yeah.
Well, what is the situation? This is a big question. I think a lot of people might want to know. What is the situation like in Central Oregon when it comes to suicide? Is it getting better? Is it worse? Is it what kind of trends are you seeing? And hopefully it's improving year to year. It might not be, but what can you tell us about that?
Yeah. Well, our program puts out a suicide data trend report every several years, and our most recent one, which we released around this time last year, covered 2 decades, so 2000 to 2020, and what we saw in that research and data analysis is that we have roughly 3 people who die by suicide per month in Deschutes County. And, we see that roughly 58% of all ages, all demographics of Deschutes County residents die by suicide by firearm, which is higher than the state and the nation. So, we have some efforts, which we'll probably speak about, to try and counteract that. What we see when we kind of look at preliminary data, so this is data that just hasn't been validated yet by the state level, is that for youth population, it does appear that we might be in a downward trend when we look at the last several years. So part of our program, we do postvention outreach. Postvention is where we respond after a suicide death in our community to promote healing and make sure that people have the resources and supports and services they need so that we can prevent further suicide deaths. So with that, by doing postvention, we can kind of see some trends in real time which helps inform us to see that we're looking like we're having a downward trend with youth suicide. So hopefully we can keep doing that. There's a lot of preventative efforts that our program and other health promotion and prevention programs on the public health side are doing to help with the rates lowering.
Where do you do this prevention? Because I know it's a lot of, social media, your website, is schools. I imagine some trainings. What kind of prevention is it, so to speak?
Yeah. Well, we really touch any system that serves
all of it.
Serves our community members. We definitely are heavy with school districts. So we work across all 3 school districts in Deschutes County, and sometimes we support outside other school districts because of our alliance that's regional and some of our regional projects to help lower youth suicide deaths and attempts. But we work behavioral health, primary care, healthcare systems. Trying to think of some other ones that we support: law enforcement, chaplaincy,
veterans, populations.
Yeah, Spanish speaking. It's
all
really
over the map.
Yeah, because suicide doesn't discriminate. It touches many people's lives, so we really have to be able to.
I was going to ask you about that, and Caroline, I don't know if this is for you or Bethany. Either one of you, please feel free to weigh in. But you talked a little bit about youth and demographics. Are you trying to target a certain, age group, demographic when it comes to prevention? Females versus males. What are you seeing?
Yeah. Well, with the youth population, we do have legislation in our state for ages 24 and under to prevent and respond to suicide deaths of ages 24 and under. So there's one age bracket, when it comes to young people that we focus in on. We do know that female youth population do show up to the ED with more mental health issues than their male counterparts. So that also includes suicidal ideation and attempts. And so we know that there's that pocket, but we really try and make sure that our efforts for the youth population spread across all youth in Deschutes County.
Yeah, and we know statewide, some trends that we're having, we're seeing a decline in white cisgender youth. So we're expanding our efforts to be more culturally aware and culturally responsive to those who identify as BIPOC or LGBTQ+, because we know that the efforts that we're doing impact different populations differently. So those are ones that we're kind of bolstering efforts around right now as well, specifically within youth.
Yeah.
Well, kudos to you both for doing this work. It's hard. How in the world, and we talked a little bit about this before we started recording, but you guys are fun people. This is a hard topic.
It can be, yeah.
I mean, and it's like, you don't want this aura to come in as soon as you walk in this suicide prevention folks are here. We got to be. How do you process all of this and not take it home and affect your day-to-day life? That must be really difficult.
Yeah, I mean,
not to get too personal on you guys,
no.
I think it's important to understand how you manage that.
Sure. Well, that question flashes me back to when I interviewed for this position, and it was a key part in my interview to make sure, do I have the things in my life to support myself, knowing that it's a hard topic and we'll see and hear hard things. And, I think my background in behavioral health and being trained around how to manage difficult topics and support people in difficult times has helped give me a good foundation. I definitely, just like we promote out in the community, having multiple tools in your toolbox when you're stressed or things are difficult. Also recognizing that sometimes you will take it home. I mean, we're human. It's not like we can turn it off all the time. But I think for me, it's been helpful having multiple tools in the toolbox. You know, I like to ride my bike. I have dogs. I go on a walk with the dogs. You know, whatever makes sense for me that day. If I'm feeling like I need an outlet, you know, that helps. So,
yeah. I would say, aligning with Caroline, practicing what we preach, always working on our mental health is really important. But also having a teammate in this work, remembering that we're not alone and that we get to rely on each other, tag in and out when we need. I think it would be a completely different experience.
You guys
if we
are
had to
pretty
do this
tight.
alone.
yeah.
You guys hang out outside of work too?
Yes, we do.
Yes, we
Do you really?
Yeah.
Walks,
I mean, I
bike
think-
rides.
We do the mental health things outside of work together.
Yeah.
It's a great support.
Well, I would imagine that would be super helpful because then you can recognize when she's having a bad day or having a rough go of something that you're talking about or dealing with, and vice versa. I imagine that's helpful.
Yeah. I mean,
Unison.
Who brings who coffee is what I want to know.
I usually come in. She gets there at 7 a.m, so I'm the coffee bringer. I come in later.
Caroline's the early riser.
Yeah, that's when the brain works the best.
What do you want people to know about your team, your efforts that maybe people don't know about? Because, I mean, it seems simple. Just tell people, you know, what you want them to know. But I imagine that, you know, when I first started working with you when I was in health service, there was so much that I didn't know. How to say things, how to approach things, how to deliver news publicly in terms of even this podcast, the website, talking with media professionals. What is it that you find yourself going, man, I wish more people knew about our job? Ugh.
That's hard.
Yeah, I think that one.
That's what we do here. Tough questions.
Hard.
No.
I'll jump in. One thing that has been coming up, it feels like for me, is just really reducing that stigma that we're all humans and talking directly about suicide is okay. It's supportive. It's just like any other health condition. And that there are safe ways to do it. There are reasons why we do the things that we do. But just kind of normalizing the conversation around it, I think is one of the big messages when we go into schools, especially. We're wanting to normalize it so youth can do those help-seeking behaviors. They can have trusted adults. People are willing to just talk about it. What else do we want people to know?
Yeah, the other thing that I was thinking about is that, you know, a lot of what we share out in the community and internally is all backed by research that's pretty extensive. And the research is not only just, you know, what we kind of imagine research being, very, very science-based and kind of clinical, but there's also research from loss survivors and attempt survivors that inform the reasons why we do what we do and what we're trying to share out in the community. And to recognize that research and the best practices that we share out have a lot of meaning behind it, and that it's aligning with just, you know, a lot of research with a lot of trends to inform us that this is the best way to prevent suicide and to support people who have been impacted by suicide. Sometimes people might look at our research as, you know, skepticism or maybe not knowing it. And so really coming from a place of that there's a lot of extensive information that informs what we do to share out to the community.
I'm curious how you balance confidentiality and outreach.
Yeah.
Because I would imagine that it's difficult. You don't want to tell too much about people's stories. And then, but also want to educate people based on experiences, I would imagine.
Sure. Yeah.
How do you balance that?
That's a great question. So we do always ask that media not be present at our events just for that overall confidentiality of the participants. But then when we go into the events, we don't we stay away from, and our research suggests the same, staying away from like open sharing of stories. And so if we are going to have a speaker or a loss survivor share their story, there's a lot of coaching involved in how we can do that safely in a suicide safe way. We have all sorts of guidelines. Also, our outreach team is amazing at coaching people with that, of going through their story and talking about where we can instill hope, where we can instill resources, and where we can talk about like feelings rather than getting into graphic details that can be traumatizing and harmful.
Yeah, I would think that would be so hard because people relate to stories.
Mm-hmm. Yeah.
And then you almost have to speak in generalities.
Yes.
Mm-hmm. Is that what you're finding, or is that what you do?
Yeah,
Yes.
it's always this dance that we have to do.
Tiptoeing, I
And
imagine.
making sure not to exploit the speakers as
Right.
well, because that's we've gone to many conferences where there are many sessions about how to do this with the research backed. But yeah, it does become more general, very strengths based, very resource based, and again sharing feelings.
So your outreach, sure, targeted at people who might be going through things, but probably do you do work aimed at for employers, professionals, as to how to me,
Yes.
you know, I mean, to like how to navigate. I keep using that word, and you use dance, but how to, what words to use, how not to, get too open about people's experiences, not to spark emotion. I don't want to use the word trigger because that's a trigger, but it's, boy.
Yeah. We have lots of ways that we do that. First, we offer some pretty standard evidence-based trainings, but we also oftentimes meet with tons of organizations and really suss out the nuances of what their needs are, and then we're able to tailor presentations, education, and resources to what their needs are, and that's some of the favorite work that we do, where we're able to really help provide exactly what the need is, because since it is such a complicated and uncomfortable topic, sometimes there is a very specific need.
Where can people go for help? I mean, I know that's
One of our favorites.
to talk about.
Yeah.
You like that
Resources.
question.
Well, first,
Resource. Here we go.
to your last point, if you're an organization or a system, you can come to us. We love to just set up a meeting, have that conversation, and figure out how we can support. But if you're an individual needing support,
Yeah.
you want to...
988 is always one of our favorites. It's our national
Text or call.
Text or call, yeah. So you can dial 1 if you're calling for veterans. You can dial 2 for Spanish speaking on the call, and 3 for LGBTQ plus folks. But yeah, it's 24/7, available to anyone. It's free. It's confidential. It's mental health professionals on the other line who support people not only in crisis, but also if you're just having a bad day, you're in between appointments, you need someone to talk to about substance issues for yourself or a loved one. There's all sorts of reasons to use 988. So we would encourage people to not hesitate to use it if they're struggling for any reason. A lot of the factors outside of suicide, substance abuse, financial issues, whatever the case may be, those are risk factors to suicide. And so 988 tries to prevent suicide by supporting people in so many different ways. So
988.
988.
Bethany, what else?
Our other favorite is, of course, the Deschutes County Crisis Stabilization Center.
Yes.
Can walk in 24/7 when you're in crisis and access that support. We feel so lucky to be able to have that resource here. It's amazing.
That's a big one.
It's a big one. Yeah.
You've been working on, we talked a little bit about it earlier, safe gun storage. Can you talk about that effort a little bit?
Yeah.
So when looking at our suicide rates by firearms, not only in Deschutes County, but just in our region, and seeing that we are higher than the state and the nation, our alliance, COSPA, or Central Oregon Suicide Prevention Alliance, really looked at that data and made a decision that they wanted to respond to that. So Bethany and I support, as well as Crook County Health Services and sometimes Jefferson County, support COSPA from the back end to do these projects. And so they determined that they wanted to work on educating, create awareness, and increase resources related to reducing access to lethal means, so specifically firearms, if someone were in crisis or struggling with mental health. It's not a project that's around restricting rights. We walk alongside firearm owners of English and Spanish-speaking populations to inform the messaging and what types of resources we should be included in this project. So it's a collaborative process across our region with our firearm owners to make sure that the education and resources are meeting their needs to reduce access temporarily. So yeah, there's a public service announcement. There's 2 in English, 2 in Spanish, and it drives people to our website, which is safefirearmstorage.com, and there's all sorts of resources for all different populations on there.
And yeah, the original concept for this project came out of, again, evidence-based research that creating time and distance between someone and their lethal mean, and that can be temporary time and distance, is really impactful in preventing suicide and saving lives. Those suicide crises are very short, and so if we can create time and distance during that, then we can often have really positive results.
Super important.
Yes,
Super
very
important outreach. Okay, so you've got that going on. You've got the month of September. What happens October 1 in terms of what's the priority for your efforts in terms of, getting the word out and educating and helping people?
Yeah, so we just keep our projects ongoing. I'm just trying to think of our calendar. Starting in October.
Put you on the spot.
Yeah.
What are you doing next? Come on.
One big thing that we do this in the spring and in the fall, but in the beginning of October, we have an assist training that's applied suicide intervention skills training. And that's a giant 2-day evidence-based training that walks someone through kind of their own beliefs and biases about suicide, how you would ask someone directly if they're thinking about suicide, and then how to hold space for someone in order to work with them to create a safe for now plan. So we hold that for people in our community that work with youth serving organizations mostly, and that's a big one.
I would say that in November, the Saturday before the American Thanksgiving week, we always hold loss survivors free event. And so in October, we prep for that with our alliance to arrange and organize for that. It's meant for loss survivors, a place for recovery and healing and resource sharing. And so a lot of lived experience in the room who gets supported through that event. And then we continue to support our school districts.
The school year
do a lot
starts.
with Senate Bill 52, which is Addie's Act, making sure that they have suicide prevention, intervention, postvention plans. So we support them a lot with that.
Year-round efforts. And you're a team of 2.
Yes.
It's a lot of work for 2 people.
It is a lot. Yeah.
We like to keep busy.
Yeah. Yeah. And we we try and lean on our partners as much as we can. I mean, the Alliance is super helpful with our work because we have so many different sectors at the table to kind of spread the wealth as far as our projects go. And then, we collaborate with like we had mentioned before, the other programs in our prevention and health promotion to help with things.
Yeah, prevention's a big thing in Deschutes County Public Health. So there's other things in regards to, it's not just suicide that you guys are dealing, I mean, that's your focus area, but there are other people in Deschutes County work, vaping, gambling, healthy schools, lots of things. We've big stuff out there.
Yep.
Well, you guys are fun people.
Yeah.
Thank you.
We'll have to bring you back and talk about all kinds of fun things once.
Different time.
At a different time. But this was an important topic. I'm glad you guys came in. September, big month. The PreventSuicideCO.org website. Did I get that right?
Yes, you did.
Okay, PreventSuicideCO.org. Place to go for all your information about the walk, the 988 day, the candlelight vigil. You can get information there.
Yeah. And we didn't even get into that we have a secure firearms storage or counseling on access to lethal means event. And then we also have a mental health promotion event that will be all in Spanish this month as well. But all that information is on the website.
On the website. It's on, we'll make sure to get it out on our social media channels.
Yeah, thank you.
We'll share all that information there on the health services, Facebook, Instagram, Spanish. We're gonna share it all.
Yeah.
Yes.
That's awesome.
Thank you.
Outreach.
Love it. Yes.
Caroline Suter, Bethany Kuschel, thank you so much for joining us.
Yeah, thank you for having us.
We've mentioned it earlier, but it's worth repeating. If you or someone you know is in crisis or thinking about suicide, please text or call 988. The Deschutes County Stabilization Center also provides a wide array of crisis services to the community. They're located at 63311 Northeast Jameson Street in Bend. They're open 24/7. And an entire list of resources is available at deschutes.org/suicide prevention. You can listen to us wherever you listen to your podcasts. You can find us at deschutes.org/podcast as well. But until next time, please be safe out there.